I think we're far enough into it that we can get started with Nora. I think a lot of you are here to hear what she has to say and talk about stuff that her company has done with AI and social prescribing. And I have something in my eye. So I will turn this over to Nora to introduce herself and share with us what she's learned.
Thank you so much for having me here. Can you see our background from the slide? Perfect. Thank you, Jen, for the thumbs up. Yeah, my name is Nora Hackmann. I'm the co-founder and CEO of Kenji Health. And I had the opportunity to meet a bunch of the social prescribing USA folks, Jen and Ivory and Alan, a couple of times already. And I wanted to share, we are based in Santa Monica, so California based, but actually have been working quite a bit in London where the social prescribing setting is a bit more evolved. So I wanted to give you a couple things today. So first of all, we'd love to invite you to a discussion around social prescribing and have a couple of like structured prompts. I just put a link to a Padlet in the chat, which I hope that you can all access. But I will go through that in a moment as well, but want to make sure people can pull that up. Then give you a very quick 5-minute overview of what Kenji's products look like, and then share learnings from our most recent pilot where we really looked at, can we use AI to enhance engagement with social prescriptions and the kind of the experience, but then also how do we think about measurement? How can we bring the human perspective at scale into how we evaluate any programs across arts? We've been focused on arts, but obviously applies to nature and movement and other aspects as well. And then just wanted to share a couple of like partnership opportunities we also have been coming up with this group. So why don't I get started? So first of all, quick background. My background was like half of the career in consulting, working with foundations and healthcare organizations, and then did a little bit of a switch and spent some time at Facebook and Meta on new product innovation and developing new apps. And really, this is a combination of both of that. And I teamed up with my partner, Martin, who is a professor at UCLA, really focused on health outcomes measurement and using machine learning techniques to do that. But he's also doing quite a bit of like matching and really thinking about how do we reduce information friction in the healthcare system in order to improve outcomes, both healthcare outcomes and financial. And we were really lucky to start working with a team at Queen Mary University in London. Maria and Francesca are professors there, really focused at that intersection of creative arts and mental health. So Maria is a psychiatrist who leads the program, a master's program called Creative Arts and Mental Health, and Francesca is more focused on the economic side. And they've been amazing in just creating a community around community-based organizations that drive amazing programs that help so many people. But I think what they're missing is really a tool to like measure that at scale. So that's where we felt like bringing Kenji to that setting would help quite a bit to assess the amazing work they are driving. And we all know why we're talking about this. There's a huge growth in healthcare conditions. I just pulled out a couple of numbers here, especially I think loneliness and social isolation is something where social prescribing can be extremely powerful. But on the other hand, we see that supply side, the healthcare system being overloaded, lots of shortages on access to mental health professionals, and also reports that 50% are burned out. So just wanted to put that as a context, and then pulling out a couple of notions here, how we think about community-based organizations that in the US can fill that care gap, and which makes me so excited about this work, because we do have so many community-based arts organizations and arts institutions, and we know that art can be really impactful in improving different mental health markers, but also movement, nature, volunteering. But we believe that they are all underfunded and underutilized in filling that gap because the outcomes are so hard to measure. So just taking kind of like my product head on, like what are really the pain points we are addressing? So what we've heard is it's really hard to get to sustainable revenue streams as an organization. So it's like grant applications over and over to get some funding, or getting service revenue streams is also something where we don't see the consistency among a lot of organizations that try to balance donations to make it accessible, but on the other hand, we also have to sustain their operations. We also learned that outcomes collection is really hard. So surveys see often really low response rates. It's very tedious for staff to spend like up to 20% of their time to do outcomes measurement. We heard that surveys are perceived as frustrating, dehumanizing was a word that I heard, where people feel like it's not about they're getting asked what matters to them. I think Julia is like really promoting that slogan of things that matter to you, and find it hard to really get to that. And I think that's something we want to solve as well, to really bring that human perspective and what people want to report on to this. And we also don't see much of a standardized evaluation framework yet that will help to like really unlock healthcare funding here. So I'll go into like some more of that, but I would love if we could jump over to the Padlet for 5 minutes. Can I get a show of hands if you were able to like access it with the link? Otherwise, I'll pull it up here on the screen and make this a little bit interactive, because I think there are 3 questions I would love to hear from this US practitioner community.
Sorry, Nora, did you
in a sense that, was it?
Did you drop in a link yet or not yet?
It's in the chat, like it should be the second addition to the chat. I can like re-add it as well. Do you see it, Jen?
I'll go ahead and reshare that.
That would be amazing. So I wanted to like dig into 3 questions. If you can you see the screen here now? It should be really easy, no sign up to get into the Padlet, but if that doesn't work, I'll skip that step and maybe make it kind of a race of maybe some people can come off mute to make this a little interactive. But I think the things that are really, I think, top of mind that I think this community also wants to discuss, wants to think about, is kind of like, first of all, like what outcomes and impact data is really relevant. So what should we prioritize for the different use cases? Maybe it's a grant application, maybe it's improving the program itself, maybe it's like really communicating to participants whether a program is the right one or not. So that's kind of the first one. So an example here would be like improved well-being for grant applications and reporting, which we served in one of our situations in the UK. Measurement challenges that we have. So what challenges do you see in your practice, or what do you see in other organizations struggle with? Because we've heard that's plenty hard, and I bet that applies here as well. And lastly, so for example, the low response rates I mentioned. And lastly, what tools do we use in our practice to measure impact, to really understand what the work does to whoever participates. So we know there are custom surveys, the Warwick, Edinburgh. So wanted to just like put this out here. And if you jump in, it's quite, should be quite started to just like add on the plus sign here. And then it opens up a new window, and you can just like type a response and then drag and drop it to like one of the 3 questions in here. So curious if somebody wants to like jump in and share some of their perspective around what outcomes you tend to prioritize, or what challenges you experience around that, or lastly, what tools you currently use, standardized surveys or interviews or others. I think it. So maybe I'll give it 3 minutes until like 20 past to get a couple of responses here. Measuring of loneliness and belonging is one answer here. Awesome. Yeah, I see a lot of really good answers coming through here. Yeah, so this notion of self-reported symptoms as well as physical health changes. Loneliness seems to be a very relevant one. Meaningful connections. Some different surveys. Lack of time is something we've heard over and over again. And I think this balance between nuanced, qualitative ones, and then the hard numbers quantitatively to measure. Tied to productivity. How do we retention, absenteeism? Is this around participating in the program, or also probably like who's attending the sessions and isn't? Awesome. Yeah, if you want to keep adding, we can like have a look at this after the session, and then I would hop back into the presentation again. Really appreciate the engagement here. So I think this is very consistent with some of the feedback we've heard when we started working in the UK, where we see this on the one hand constraints that we see. And what we wanted to do is create something that feels valuable and adds value to the participants as well, but allows us at the same time to collect data. And we're using AI, a large language model similar to ChatGPT, that is trained in specific ways to talk. Like we've been looking at motivational interviewing as a tool to engage a participant in the conversation, but it's like knows about like what program somebody attends. We feed some data about the organization, but creating this interactive reflection space that proactively checks in with the participant while they're attending a program. So let's say we had a theater group, for example, in one of our pilots that met once a week. And we would check in around that time, like right after that, and see whether somebody, how they're feeling about their experience, but also how their well-being is tracking, and asking about different aspects like how energized somebody feel, how interested and optimistic about certain things. And then on the other hand, we really want to support the organizations that offer the social prescribing program and the arts program in our case. For that, we have Kenji Compass, which really like summarizes some of the data collected in an anonymized and aggregated format about their participants. So a little bit more context here. So when we have built Kenji based on WhatsApp, which especially in the UK is extremely popular, easy to access, and trained it in evidence-based psychology and worked with our psychiatrist, Maria, to like really inform it how do we construct this conversational protocol. And it will like multiple times a week proactively check in with a participant and also reflect back what has been discussed. So really think about that engagement loop and deepening the experience, what they're participating in. We also really personalize it that over time it learns about the person and is customized to the program. We also want to make it as fun and engaging as possible. So worked with a friend here in LA who writes for TV shows. And add this like added level of encouragement. We also want to make it accessible. So that's why we built it on WhatsApp, and obviously it's available 24/7. If you want to try out a very brief demo, I have a QR code on the slide. If you have WhatsApp on your phone, it's a very brief onboarding flow. If you want to try it out, feel free to do that. It's right up there. So if you want to do that, I can also like circulate that after our call here. And we tested it and got like really like positive feedback from participants. So many found it like really friendly and inspiring, motivating, said it helped them to stay grounded and focused, and felt like it was easy to put feelings and thoughts down. So the positive effects of journaling. So saw that as an encouragement to find an alternative that doesn't feel as one-sided as something like a survey where you kind of feel like you share your information and it doesn't kind of like give you the feedback. But on the organization side, we are really focused on a couple of things, like how engaged are our participants along the process, which we can track, like what are kind of impact profiles we create. I'll show you how that looks like in a moment, and also compare to other organizations, and lastly, tracking of the Kenji Wellbeing Score that is constructed based on their unstructured conversation histories. So in the feedback we got from the organizations that have worked with us is really helpful for somebody who is already quite isolated to be asked how they're doing. But also, like on outcomes collection, one of them quoted that they increased their outcomes collection and response rates by 60%. Another one said, like, hey, this was minimizing the effort we put in as an organization because it's all automated. And it's usually easily 20% of our time to collect the same kind of information among their staff. But also, like, really positive thoughts on like our safety protocol and how we are able to bring that nuanced qualitative insights, but also the hard facts that hard numbers funders care about. Oftentimes I get the question around, like, what about the safety of an AI chatbot? I think you probably are all familiar with the different stories we hear about how people spend too much time with certain AI characters. And so we spend a lot of time to make sure we have, first of all, responsible design principles, extend kind of consent forms and like education about the use of AI, privacy protection, add another layer of AI moderation. So if there's concerning language that is detected in the conversation, how do we loop in a mental health professional and share other resources that somebody has at their disposal? I can go into like anything in more detail, but I also want to be mindful of time. So we'll just share kind of high level here to get to the actual pilot. So for the pilot, we did an ethics review, so an IRB reviewed study with Queen Mary, had 75 participants over 8 weeks and collected 6,000 user messages. The 4 arts organizations we worked with were Art Peru, which is a dance class for immigrants experiencing loneliness and isolation. Cardboard Citizens is a theater program for people impacted by homelessness. Popular Union is an arts and community space in one of London's most deprived neighborhoods. And lastly, Outside Edge, a theater program for people impacted by substance. And we shared Kenji with them, like they distributed our QR code, though similar to what you saw just earlier in their sessions. And we took over kind of the checking in with their participants. And in summary, at the end, we asked them, what did you prefer, like receiving the Warwick-Edinburgh Wellbeing Scale or Kenji, and like a couple of nuances around that. But we saw really high engagement over time. 89% of participants preferred talking to Kenji multiple times a week versus filling out this 2-minute well-being assessment survey. 80% said that Kenji was more reflective of their well-being, so better kind of like ask about like what matters to them in terms of their well-being. And then we also asked, like, would you like to continue using it? 60% said at least once a week, 90% at least once a month. So again, I think very encouraging that this is something that adds value to the participants and puts their perspective at the heart of the outcomes collection. On the other hand, on the data analysis side, we were really able to automate that measurement of the unique benefits of a program, and also test whether our well-being score that we construct based on the unstructured text data is correlated with the Warwick-Edinburgh scale, which is a validated well-being measure. So I think I'll jump over this because I just alluded to that, but then go into the measurement part, which I think is really core to our discussion here. So we really wanted to get to a point where we can take that natural language processing as a tool to measure well-being based on that unstructured data, and also help to identify what's the value add of the intervention they're part of or the program they're part of, to estimate the effect of social prescribing on well-being. And what we started out was like really research backed, like what are usually the factors we see how social prescribing impacts well-being. We can construct it into those 3 buckets: personal growth, where we have 3 markers: passion and purpose, creativity and self-expression, and new skills and sense of accomplishment. Social health, so fostering belonging and new connections, deepening existing connections, and the last one was cultural connection. But then also mental health with positive impact on mood, reduction of anxiety, and anticipation optimism. We want to know, do we see this in the data? Can we make a statement about how an individual's perspective is and experience is depending between like what they're participating in and how they're feeling. And we were really able to construct quantitatively that we found those themes again in those individual perspectives. So I'll take a moment to explain this graph. So we have our markers that we identified came through in the chat histories. We measured out of 33 where we had enough data to construct some meaningful insights. Passion and purpose, new skills and accomplishment, improved mood and anticipation, optimism were the ones that came up in all of those, almost all participating chat histories. And then we also wanted to know to what extent do they feel that improved. And here again, passion and purpose is something that predominantly came through where on a scale of 1 to 5, where 5 is strongly agree, people really felt like they found a meaningful activity that provided them some sense of purpose. Or other examples here, the improved mood was also something that was very prevalent. We also wanted to know, is this like relevant for just a few users in our pilot or for everyone? And there you see like really interesting variations, that this feeling of accomplishment and developing new skills was one that was, for example, like fairly relevant for many, whereas the cultural connection piece, because that was only really one of the programs, has a wider spread here across ones. I'll stop here. Is there any questions that anyone has about this? Because this is like core of like how we think about measurement with what we do.
I am curious, was this over a particular time period with one program?
Yeah, exactly. This was for 8 weeks where we had bi-weekly check-ins and collected kind of this like messages over time. And then after those 8 weeks, aggregated the data.
Thank you, Nora.
I have a quick question. I'm wondering if you found, like in the United States, I'm finding older adults are less reluctant to engage with WhatsApp or with online types of things like this. Any thoughts on that or reflection on ages of participants?
On age, we didn't collect age group, but I think there was I think what helped in our like engaging with WhatsApp was like predominantly the programs interacted with their participants already in WhatsApp groups. So that was not the challenge. We had one program that offered a course for the 65 plus age segment. There was a little bit challenging to get participants go through the onboarding flow. We like joined that session and like helped them navigate it. But I think in general, it feels like from what we anecdotally know where the age group was, it works really well for young adults, but also for the, I don't know, mid-range flies quite well as well. All the measured. Yeah, I think Maria, I saw your questions. That's because we start. So yes, the answer is like we can look at other measures as well. We started with those like most research-backed ones that we see across the many pilots that have been done in measurements, but we can absolutely also focus it on other things. When, for example, I think here a lot of organizations are really focused on racial equity and like making sure like we tap on that and like see whether there's something that comes up there. We can change the conversation protocol as well, that it triggers conversations that are specifically relevant here. So I think that's kind of something we are still also learning and like adjusting to what needs we have. Are there any that you would be particularly interested in? So I think that's something we are still kind of working through, but definitely is yeah, sounds good. And then Rebecca had a question about languages. Yes, definitely the more popular one. So we had about, I want to say 20% of users interacting with Kenji in Spanish, because that's their language and they were comfortable in. So that works very organically. You can just be like in the app, so I would prefer speaking in my language, and then it will switch over, and it works really well. Yeah, and then maybe moving one step ahead, I think the other question that you also want to think about when we think about kind of the whole like the social prescribing ecosystem and referring out from a provider, we can also use this to create program profiles where we compare different programs to each other. So here we pulled out like different ones and see that maybe program 1 is spikes on passion, purpose, and improved mood, whereas program 2 really fosters creativity and self-expression. Whereas lastly, like the program here is maybe like a spike specifically on improved mood. So I think that's like, the more we learn about a program, we can like very clearly indicate, oh, if this is somebody who maybe would really benefit from a creative practice, this program might be really good for that person. Or this is really about like somebody who's struggling with depression, so focus on mood, or isolation, so like something where connection stands out. And I think this could be like a really good guide to help people find the right program for them. I think that was. And then the last question was like, can we predict well-being? And there the question was like, first of all, do we get more data than in a traditional method? So this compares the Warwick survey that we fielded at 3 points across the pilot, and there we only received 45 out of 75 responses. Whereas the Kenji score had a higher response rate, where across 65 we had really good data that we could construct a well-being score based on. So first of all, it was like that worked really well. And then secondly, we wanted to know if we take the data between what people shared in unstructured data and construct a well-being score based on that, does it help us to explain what we find with the Warwick Edinburgh scale that we collected at week 1, week 4, and week 8? And we were able to come to a way to measure based on the Kenji conversational history that is like correlated at a 66% correlation here, and is able to explain quite a bit share of well-being that we would measure with a validated scale. But we wouldn't, like in the future, you then won't need wouldn't need to have to like fill out the survey. So yeah, so this is kind of summarizing some of the data. We're also working on really a model to show that improvement over time. So the Kenji score was able to also explain like kind of what is the improvement of that well-being score while people are in the program, because we are real time and check in multiple times. So lots kind of like to learn there as well. So I'll pause here and see if there's like any more questions. I'm like checking in the chat right now.
Or did you see
Okay.
Ryan's question? I'm not sure if you saw that one.
Ryan.
How do you anticipate this will create an unhealthy competition across programs? Or do you anticipate?
Yeah, that's a good question. I mean, I think it's like where we are not yet. I mean, this is like, I think it's like, how do we share that? Like, is this something publicly shared, or is this something like only a recommender, like a healthcare provider, a link worker will get access to? But I would hope it's not. But I think that's something we're currently constructing follow-on pilots on this and want to test on, because we obviously don't want to make it unhealthy, but we also like want to drive improvements of quality. So I think that's definitely a positive benefit of creating some comparisons.
And Tracy, go ahead, your hand's up.
Thank you. So if I understand correctly, you're essentially mining the data from the surveys in order to get. So then my question is essentially, I'm curious how you would publish research from this. Basically, what I'm wondering is if scientists were going to look at this for like validating the measures that you're using, what would they compare this against? Because I know that's where the field, like where NIH is in terms of looking at social prescribing and wanting the evidence to prove that social prescribing is a good thing. And so I'm really curious, like where this is going next in terms of the science and how Kenji is going to help advance the field in terms of publishable research.
Yeah, so we are gonna publish this paper, which basically shows the connection between a validated scale and the insights we are collecting with the unstructured data. So we'll definitely put that out. But I think in the future, we would love to like do larger scale, longer term studies as well to compare standardized metrics of well-being measurement, like also different scales, to how we analyze data. I don't know if that makes sense and if that answers the question. Is your question because it's like unstructured and we wouldn't like release all the data to protect privacy?
No, I mean, I think it's structured. I guess it's just that, you know, I'm a musician, so, you know, like I'm a pianist and I'm still kind of learning how the field works. I'm not a social scientist. And so, you know, but as I understand it, the way these measures get validated over time is they keep getting tested and reused and tested, you know, and then, and so, that I guess becomes the question is like, how does what you do compare against the validated measures like the well-being scale that other people are talking about? And so, you know, how do we then validate it over time, or how do we, you know, so.
Yeah, no, exactly. And this is why we run research pilots to do that validation, where we, in the initial phases, we collect both a survey that is validated and trusted and compare that to what we are collecting with our score to establish that as another standard, another alternative that gives a bit more richer nuance, but also gives that hard score. I think that's really what we are like trying to build in our research agenda, that we keep validating that.
And the other thing that I like about what you're doing, and what I would be curious about is to have I have a colleague who's a medical anthropologist, and we're looking at doing some pilot research together on, you know, on basically music interventions in the community here. And it would be interesting to have somebody who's in that field look at the surveys that, you know, and look at the AI generated questions, because it's more qualitative research, and you're essentially generating the types of questions that an anthropologist would ask in a you know, structured interview. So I find that really fascinating.
Yeah, no, I appreciate that. I maybe as a summary, I think that's exactly what we are trying to bridge. This is on the one hand the like very standardized surveys where somebody else decides what we should care about, but it's not really about the participant, what they care about, what their which you can much better like pull out in a one-on-one interview that you can adjust based on what you're asking. That's exactly how we trained the AI to be able to start very open-ended. Hey, how are you feeling today? And like, do you want like, how's your energy level today? And then maybe going from there and constructing kind of a conversation in some way that replicates how maybe an interviewer, a social scientist would ask those questions, to be able to balance that nuance and the quantifiable aspect of that. See, I just want to see, do we have another question in the chat that I haven't answered yet?
I think this is really awesome, Nora. I think that so many of us are looking for data collection points and how to navigate that. So this is a cool idea, and I love the thing.
How can you use a link worker? Yeah, that's a really good question. Maria, I feel like we should have a conversation after this. I really like your questions. I think this is something we've been, like in the UK, I think has like 9,000 or 10,000 link workers trying to help people connect directly into the community and find resources. And I think there is something about we can probably create more transparency. What are the programs that are relevant for you? How can we better match you to something with the data we collect? If the link worker is meant to follow up and keep track and do that follow up as well. So we're thinking about like, how do we aggregate the data for certain stakeholders? Because when you think like the individual that participates wants to track maybe their well-being and their reflections about the program they've been investing time and participating in. The organization, like the facilitator of the session who leads the social prescription might do that as well. It has different ways to like improve their program, for example, and maybe the referring GP wants to have a feedback loop to track how their participant, like their patient, is doing. So I think that's kind of like different ways we explore how we can use the data in the best way.
And
yeah,
Nora,
yep. Mm-hmm.
Someone else was speaking, and I'd love to give them a chance to talk. I was just going to say, Nora, can you throw your contact information in the chat so that if people have ongoing conversations, I feel like people are really excited about this and look forward to connecting you with you on that. I just want to make sure that they have access to, if we move on and ask a couple questions about website stuff with the community that we had before.
Yeah. Yeah, and I mean, maybe last thing to wrap up, we are currently starting to ramp up another series of pilots we want to run. So looking for organizations who would be interested and who like ideally offer regular programming where we can really see a trend over time. So would love to hear from your kind of needs to evaluate what you're doing, if especially on the practitioner side. So yeah, feel free to reach out. My contact is in the chat.
Awesome. Thank you so much. Really appreciate that. And all the people who have taken the time to put together presentations and present their information for us, like, I think that's really cool.